You get to run the show. You get to run the slides. I'll just introduce you. Okay. They're going to come up there, right?
They should.
Wow, my mother would be proud. I'm up on the big screen. Good morning, everyone. Welcome to the Town Hall meeting for the SSH certification program. Certification, as you know, is a voluntary process in which individuals may seek validation of their knowledge, skills, and attitudes as a certified healthcare simulation educator. My name is Joe Lopreiato, the past chair of the certification committee. Our current chair, Sharon Decker, at Texas Tech University, is in Lubbock and could not attend at the last minute, so we're filling in this morning for her. Our program manager, Mr. Andrew Spain, will present some slides about what we have done in the last year in the certification committee, and then we will have a question and answer session from you in the audience. So if you can migrate to one of the mics, we'll go ahead and take your questions about the certification process, how's it going, what's coming up, and what's new. We do have some new products that will be rolling out in 2014 for certification, and some updates to the current CHSE program for you this morning. So hopefully you'll get some good new information and be able to get your questions answered. Dr. Mary Patterson is also one of our leadership on the certification committee, and she should be joining us a little bit later. But right now I'd like to introduce Mr. Andrew Spain, our program manager, who will give you an update on the certification process.
Are you all ready for a fun day? I know I am. We've been running 800 miles an hour, as I expect you all have as well this morning. So let's we're going to run over, obviously, kind of the update on the various certifications that we have. And it would definitely encourage that you bring up your questions here. So we're going to start by making sure you understand what we're covering. And it's essentially just a review where we are with each of our 3 certification programs: CHSE, CHSE-A, and the CHSOS, which is, of course, our newest one that we are very heavily into development currently. We began back in 2007. Yes, it takes a long time to put these certification programs together. It's quite a bit of work, quite a bit of expense, obviously, a lot of time from our committee members who have graciously gone all over the country on various meetings that I've sent them to. Clearly, we've worked with many different groups: ASPE, INAXL, CSAM, ASH, and so forth. I can't even begin to give you the list. There's a one towards the end where you'll see, get a good idea of how much collaboration we've had to put these together. Clearly, we need to have some credibility and visibility for those who are doing healthcare simulation education in the world, and this is certainly meeting that goal. We definitely see it as a service to our members and our communities of interest. And as a normal certification, it's voluntary, time limited, meets the industry standards. We've continued to work towards that on an ongoing basis, because you need to know that if you become certified, that it actually has validity, reliability, and means something in the world of certification. We often get many questions about why you certify. And this is just a short set of the reasons why you might certify. You want to demonstrate that you're a professional. There's little doubt of that. Certification goes a long way to demonstrating that. And it's certainly something that you're doing on your own. Many people who have become certified, I know, have to pay for it out of their own pocket. That is a challenge. There's little doubt when you have to manage your budgets, just like everyone does. But it has value. It confirms your commitment. It shows how you serve the industry, how you demonstrate that you're supporting healthcare simulation as a whole. It's a peer evaluation process. Each and every application is reviewed by your peers. And that is actually quite important, because it's more than just going and taking an examination. You have had your credentials, your application, your references evaluated by peers, and they have approved you to the standards even to be able to take the examination. In terms of our status for CHSE, as of last night, we have 290 CHSEs from 8 different countries. This is an international certification. It's not just for U.S. citizens only. We continue to outreach to the various countries around the world to continue to expand. And in fact, we have a couple of individuals from a different country going to test this morning. So we're hoping that they obviously pass and we can make it 9 countries. We continue to work that, because it's very, very important to understand that healthcare simulation isn't just a particular country. The principles apply pretty much no matter where you go. Patients present the same way. We need to educate somehow to take care of patients. And healthcare simulation has core foundational principles on how to do quality simulation, and that's validated through the certification process. So we continue, again, to work that. The eligibility requirements, these are all listed on our website. Bachelor's degree or equivalent, we recognize that there's a lot of very good people who may not have a bachelor's degree yet, but have done some very good things. 2 years of experience, it has to be in healthcare simulation, not aviation simulation or something like that. I mean, that seems to be self-evident, but we have to put that out there as a requirement. And of course, you can see that it's targeted towards the healthcare practitioner for our education. Key things that we've done in 2013 for CHSE is we've gone to a new online application system. As any IT system rollout, as any of you have been a part of, we obviously had a few little bumps along the way, but it seems to be running pretty smoothly right now, and is going to support our recertification process as well, which I'll touch base on in just a couple of minutes. But we capture those various pieces through the application process for when that peer evaluation occurs. And one of the unique aspects of our process is that confidential structured report of performance. And if you don't know what that means, it's essentially a complicated name for a reference that's submitted confidentially, but we have structured it to the standards. And it's a mixture of Likert scale responses as well as free text from those individuals that are acting as your references / referees. So that way we are validating your performance as a healthcare simulationist through your references to the standards on which the examination and your expected performance is evaluated. Basic process. Just take a look at those eligibility requirements. Do you meet them? Once you believe so, you submit your application and the fee. The CSRPs, your references, they automatically get an email when you hit that submit button. Once we have those received, then we go to our reviewers and say, take a look at everything that's been submitted. On approval from the reviewers, we send it out and say, yes, it's all good. You receive an email from the examination company with instructions on how to sign up based on your schedule, not my schedule, and your location, because we have testing centers all over through our partner in the examination. The examination itself consists of 115 multiple choice questions. We're sneaky because only 100 of them are actually scored. Saying you don't know which ones aren't scored, the beta questions. But that's obviously, we're testing future questions and things like that to the performance, because each and every item has been evaluated by peers through a modified Angoff process to ensure that not only each individual item is performing correctly, but the forms themselves are as we expect. And it's not some way off on the bell curve, left or right kind of performance on each of the exams, because there are 2 different versions of the exam, and we had to make sure that each exam, no matter which one you have in front of you, you have the equal chance that if you take this one versus this one, they perform the same. So that gets a little interesting when you're doing that process to match those 2 up, but it was a long, lengthy process, and it turned out very well from our point of view. You look on our exam or on our webpage, you have the blueprint examination. So every single question has to map back to some place on that blueprint. And that's open to you all. You can see how that works out. And it's obviously the core for are you ready for the exam? Turn each of those items into a question. And if you feel like you can answer that question, i.e., what is debriefing? Well, it is blah, 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 blah. And this is how it adapted to learners and so forth. If you have a robust answer, you don't need to study that. You should be in great shape. If you're not so confident on that, that's where you can focus your time on studying, reading articles, whatever it may be. Testing occurs all year long. It's, again, multiple locations all over. If you're having trouble finding a location, you can certainly contact myself or Kristen, and we can work you through that process to make sure we get what you need. Statistics, we've had 514 applications, 394 have actually taken the exam so far with a current pass rate of 74%. Does that strike anybody as good, bad, or right where it should be? Yes, I actually asked some questions.
I'm actually one that's retaking it. I'm retaking it.
Okay.
I didn't pass it.
Okay, and obviously we're very pleased that you're retaking it. Some of those things do seem a little out of the blue. Yeah, just missed by that much. But believe it or not, the performance at 74% is right in the middle of industry standards. Believe it or not, there's probably certifications that many of you have where the pass rate is much lower. And there's very few that have a higher pass rate. And so we're right where we wanted it to be. We've got a number of people, as you can see, that are in the pike, either at the approval process or in getting their references and so forth. But that just gives you a snapshot of where we are statistically and how, again, that we're getting what we expect in terms of performance. The recertification, we are just rolling this out because it took us quite a while to pull this together. Jared Kutzen was the chair of that subcommittee that put it together, and they've taken a very novel approach to this because there's two ways to recertify, and this is fairly common as well. You can, if you really desperately want to, take the examination again. How many people want to take exams over and over again in this room? I'm not seeing a lot of hands. How many are more comfortable submitting evidence of your continued professional development for recertification? And that's obviously what we actually hope people will do, because you are professionals. We know you're going to conferences such as this. You're taking part in different activities. And so what we're going to have you do is submit evidence of that continued professional development through that online system. And this is the types of things that we're looking at. And we're actually mapping them back to our standards. So it's not just come to a conference and sit and take courses. We're giving you credit for if you actually submit abstracts, submit posters, do presentations at a conference, take leadership roles, do advocacy activities for healthcare simulation. It's a number of different activities, and obviously there's always an other category if you think you're doing something, and the keys being that it has to be either in simulation or education. Submit those, and we will look at those and assign credits. You need a total of 45 continuing education, continued professional development units. And for instance, if here today, it would be the equivalent of one of them by going to a 1-hour session. That just gives you an example. Each thing is weighted differently because clearly if you're presenting at a conference, it took a lot of work to get ready for that, to put the research into it and so forth. And so that hour is actually worth, I believe, a couple of the continuing professional development units for just presenting at a conference. Again, we're looking at different categories. We want to see having different activities to map back to the standards. We'll have the rubric for that and the explanation of it on our website shortly. And certainly, again, if you have any questions, please contact us. CHSE-A, we just finished the pilot and announced, we will be announcing today, awarding the certificates for our first 16 that were granted the CHSE status from 3 different countries around the world. So we're very excited about that, of course. This is a portfolio-based submission. You have to be a CHSE to even start. You can see that the eligibility criteria is ramped up a little bit to 5 years and a master's degree or equivalent, because again, we recognize that there are different ways to get to what we considered master's degree level in terms of the eligibility. So work with us and we will walk you through the process as needed. The application is an extensive healthcare simulation focused portfolio, as well as having reflective statements. The reflective statements are not, this is what I do in simulation. It really needs to be, this is what I did, this is what I learned, and this is how I've gone about and improved my performance. So truly reflective on your professional performance as an individual and how you have learned and improved in healthcare simulation, because we want to see how you actually have that self-reflective capability and how you turn around and make that part of your ongoing professional development and improving your skills as an educator. It does take quite a while to pull that portfolio together. I am not going to lie about that. That's the reality, because you're looking at having to submit all the information from the conferences you've attended, papers you've written, what's on your CV. The reflective statements themselves can take quite some time. There's, at this point, we are expecting video or media submissions to actually demonstrate your work, because it's way too expensive for us to go out and do a site evaluation to get that demonstration of your work. I don't know that anybody in here would pay what would be probably $1,000, $1,500 for an on-site evaluation to check how you're doing as an educator. I don't think that would be a good price range for a certification, do you? So we have to have you submit that information via the video or the media submission so we can actually see your work in process and be able to evaluate you. Again, peer evaluation, just as in the CHSE. The process is, of course, to submit the application and all those materials and then get the evaluation through the peer review. And once you've demonstrated that knowledge, expertise, and again, it's at a higher level for the standards. It's the same standards as the CHSE, but it's a much higher level of performance. For instance, advocacy and healthcare simulation at the CHSE level may be only in your local institution. But at the advanced level, we're really expecting that you're doing it on a countrywide or even international level, and you can see that that's a very big difference to suddenly be involved at that much higher level. That's just one snapshot when you map to the standards. And again, that level of performance, those suggested evidence at the level of the advanced is going to be out there and ready, available for you, so you understand whether you meet that eligibility criteria and what we're looking for in the peer review process. We are just wrapping up the feedback from the pilot and have a few decisions to make about modifications, but at this point we're expecting to open it to the world for everyone to apply as of March 1. So hopefully that's good news to you all, especially those who have already attained the CHSE and are ready to move forward. Good news? Good news. Here we go. Are they still with me? All right, and finally we're going to wrap up with the CHSOS. We've been working hard at this one since the board said go last January. We've gone through the practice analysis. We have developed the examination blueprint. We are heavily into the item writing piece of that to get that exam developed. Again, none of these are easy processes that you can understand. By the way, what is an OS? Does anyone feel like they can define an OS? You can see an example of some of the various titles out there in terms of the jobs world that apply under the operations specialist. Because we've identified that there's clearly a different group of skills compared to the educator that falls under this operations specialist. And this gives you some idea of how we look at what they do. And it is a very diverse group, and it's going to be a challenge just as in the CHSE world. I've had calls from individuals saying, boy, you know, I really didn't like your exam because I thought it was too mannequin-centric. Would you believe that would be a possibility, that we might be a little too heavy on the mannequin-centric? Well, guess what? My next call, boy, you know, your exam kind of sucked because it had too many SP questions. I'm going to be a little tongue-in-cheek here. That means I did my job because I'm making everybody mad. But the principles are what we focus on. We may have had mannequin questions or OS questions, or excuse me, SP-based questions, but we're going after the principles. So if you understood the principles for healthcare simulation in the education world, you could answer it no matter whether it's VR, task trainers, or anything like that. It's going to be the same thing with the OS world. Maybe you never touch audiovisual equipment in your center. Maybe you never touch the IT stuff. Maybe you never actually troubleshoot the mannequins. Whatever it may be, you're going to see in the examination blueprint that that may not be your specialty area, but as an OS, because it encompasses all those different areas, you have to have some awareness. Just as an educator might do SPs only and never do anything else, there are other modes of simulation out there that you have to have awareness. In the OS world, you may only do AV. There's still other activities out there in the OS world of which you need to have an awareness level of what goes on there, because you have to understand that it's bigger than just your particular picture, just as in the educator world. And that's very important to us, because you can't be in your isolated silo and be an effective performer. And I think everybody in the room can probably agree with that, because you're probably all busy trying to break down silos. We hate silos. It makes it inefficient. Things don't work. Guess what? The operations specialist certification is the exact same way, and we're working to help break down those silos as well. Obviously, we're focused on that operations world. The eligibility criteria is identical, essentially, to the CHSE. It's just focused on the operations specialist world. We do recognize that because of the diverse backgrounds with the OS, that a lot of them do not have a bachelor's degree, and they have a lot of different ways in which they have become educated. And they may not meet that bachelor's degree requirement as easily as the educators. But we still believe that that is an entry-level requirement, and we are building a rubric that will be published to help understand that we will have many different ways to demonstrate that equivalency of the bachelor's degree and to make it easy. This is not supposed to be scary. It's supposed to be about recognizing how you as an operations specialist clearly have expertise. And that's what we're trying to move forward with the certification. And to be able to, we don't want the bachelor's degree requirement to be a stumbling block, but it does need to be a bar, that a threshold that you should meet in some means through the equivalency process. And with the rubric, we will help show you all the various things that we are going to accept. And there's always the other category, because we're not going to be able to capture everything for every single country. But I don't want anybody to be scared by that. Process, again, is essentially the same. Your application, CSRP, review by peers, includes an examination, and it'd be good for 3 years, just like the CHSE exam. The domains. This is going to be important because we will be publishing the examination blueprint to our website basically as soon as I can get to it after I get back to the real world after the conference. But here are the domains. Some of them will look awfully familiar compared to the CHSE. However, they are at a different level of expectation. You look especially at that last one and you think instructional design and theory, I'm an OS, I'm not an educator. We know, and we completely agree. However, if you can't be in the same room as an educator when they say, well, my goals and objectives are this, and they walk out of the room and you're like, what's a goal or an objective? We have a true silo in place, and we need to break that down because you have to, I'm going to use the word edu-speak. I know people hate that, but I have fun with it just as much as a lot of my other geek terms that I like to use. Because you look at that first one, and guess what? You have to have simulation speak or healthcare speak. So if the person who designed the scenario comes in and says something like, well, I need attention pneumothorax, and walks out of the room, if the OS doesn't have some understanding of the vocabulary and a little bit about what that means based on their interaction with the educators and the healthcare providers that are coming in, again, we have silos and problems built in with that. So we do have an expectation of that level of performance, being able to speak the same language and have good communication with the others that are involved in simulation. Obviously, you can see through the middle there's a lot of focused things related to being an operations specialist, be it an understanding of networking, AV concepts, how to do maintenance, troubleshooting, a lot of those things like that, because these are, again, you maybe see some things that educators do as well. Believe it or not, there's people that do both these roles. I liken it to that Sherlock Holmes hat, and today you have, today I'm the educator, you have that bill facing forward, a problem comes up, you flip it around and you're acting in the role of the operations specialist. Smaller simulation centers may actually have to do that because you're it. Larger simulation centers have the luxury of perhaps separating these things out. But when you look at the examination blueprint, you'll see, again, the things that we are expecting from the operations specialist. Our goals as we move forward: expand the educational opportunities. Make sure that you're ready to take the examinations and understand what you're going into. Obviously, complete the practice examination for the CHSE. That is wrapping up, and that will be launched fairly shortly because people would like to see how they're ready for the domains before they go into the exam. Launching the CHSE-A on March 1, and we have a rough launch date of June 1 for the CHSOS exam. Once we firm that up, then we'll be able to open the application process up probably about 2 months prior, so we can get a lot of people processed through and ready, signed up for the exam starting when it opens. We wouldn't be here without these folks. We have, again, worked very hard with a lot of our affiliates to get their input and feedback, and we really appreciate the support from all of these different groups, because without it, we wouldn't have near as good a product as we do right now. And we continue to work with them to make sure that we are not speaking a language that is not internationally accepted, that we're not missing some things particular to a certain type of simulation, whatever it may be. But we certainly want to recognize their input and just how valuable they are to their process. And here's just a snapshot of our main committee, because we have lots of subcommittees, which if I put everybody's names up, honestly, I'd probably have slides of these, 3 or 4 slides, because there are so many volunteers that take their time to come out and work for certification. And you can ask any of them that I've shipped off to a meeting, they think it's great when I send them down to Tampa, until they never get to see the water until about 8 o'clock at night, because I've been told I'm a slave driver. So I do want to thank every single person on the committee and the various subcommittees, because without them we wouldn't be anywhere near where we are today. And now is where we get to the questions. And I can't have answered everything, I know that.
If you have questions, you can use the mic, or if you're loud enough, just shout out and we'll have to repeat the question. So.
When do you think the practice exam will be ready in the CHSE?
The question was, when do we expect the practice exam to be ready? I can tell you that all the questions are written, and essentially it comes down to just getting the last bits of feedback, because we do want to have a little bit of the why it was this answer versus the other answer. That's the last piece we're wrapping up. I'm guessing March-ish. I have to also depend on my volunteers and their availability to be able to get that work done, because it's again, our subject matter experts, I have to depend on them for a lot of this feedback. But we'll definitely be putting that out as soon as we can.
Other questions?
Question back there?
How long should we expect from the time we turn in our application to when we hear? And I know I submitted in November and I'm still waiting.
Okay, that's a good question. We actually get quite a few of these because there are some time gaps. And basically the question is, how long does it take from when I submit my application to when it gets approved? The first barrier is, do your references submit their information in? And you should be able to go into the online system and see where that status is. The second barrier is the reviewers, because we have to have our 2 reviewers. And sometimes, whether we like it or not, I might perhaps assign something to Joe, and he works for the U.S. government. And every once in a while, they have a crisis, and suddenly he may not be able to get to your review, even though the government is here to help, as he will tell you, right? And so, unfortunately, I have to again ask you to go back to your platform. Look at your status, and if it's sitting in review status, call me. We reassign it and get somebody else on it who is available. And unfortunately, that's some of the things that we're trying to improve, because we do realize that some people have had to wait what I would call, since November, an excessively long time, to be perfectly honest. We want it all done within a 2 to 3 week time frame max is our goal, given on the presumption that your references get that in, say, roughly within a week or something like that. I can't control that piece because that's up to the references, but certainly want our reviewers done within a week to 2 weeks. And so work with me afterwards, or perhaps we can catch up later and we'll take a look at your application.
More questions, please?
Over here, I'm sorry, yes? For those who did not pass the exam, when you walk out of the examination center, you should be handed a sheet that describes your performance in each of the content areas. That is, okay. Yeah, okay. Are there certain content areas that people are consistently missing? And here's what we find. And there's 2 basic areas where we find that individuals, based on the feedback that we have received, where they have the stumbling blocks. One, they believe that their mode of simulation is kind of it, the only one. And I'm not trying to be mean. Please don't take it that way. But they believe that through understanding, let's just say they're a mannequin specialist, because it makes it easier to discuss. They go in taking the exam thinking, I understand how to do mannequins, therefore I understand healthcare simulation. Do SPs give us the same value as mannequins? Do task trainers give us the same value as mannequins? Virtual reality, computer-based. And I think you will all agree, well, there's a very different section of a role for each of those modes of simulation. I can guarantee you, as having directed an EMS education center, when I walked in and I saw my instructors using a full-body mannequin just to teach airway, does that make anybody else in here twitch? I've got a $50,000 airway now instead of a $500 one. That's just one thing that you as an educator should understand, the fiscal realities of various different modes of simulation, let alone the benefits. Because can you really teach communication well through a mannequin as compared to an SP? And the answer, of course, is no. And so those who are very siloed into one form of simulation have struggled with the examination, because we do expect the breadth of knowledge. Not at a super deep level, but you got to understand that here's some of the benefits and pros and cons of each of those areas. The other big area, believe it or not, that people have missed is they went in, came out from the exam, did not pass, and they said, wow, I didn't realize there was so much educational stuff that I had to know. I'm not sure, it's an educator exam specific to healthcare simulation. You must understand some educational principles, and if you don't know what comes first in terms of the process, needs analysis, developing goals, developing objectives, summative versus formative evaluation, some of those main concepts, it's all in the examination blueprint. That's the 2 big areas where we see that people have struggled. And that's the best answer I have for you.
We can probably do a better job of analyzing that, and we will. But one of the areas anecdotally people have told me is the ethics part. Thank you. The ethics part seems to have some difficulty, because probably folks haven't thought about testing ethics and ethics of doing high-stakes evaluations or even low-stakes evaluations in your sim center. So those are some other areas. We have 2 questions here. So if you use the mic, that would be great. If you can't, just go ahead and shout out real nice and loud.
Over here. Yes. Yes. And for anybody who didn't hear, Dieter is one of the many members of our certification committee. He was just, it all ties back to the standards. And even with a question such as ethics or legal issues or such like that, we were very insistent on ensuring that we met general ethical principles and legal principles germane to anywhere in the world. It wasn't just about knowing, USDA regulations or anything like that. If there was a principle such as FERPA or COBRA or something like that that was pertinent and important to healthcare simulation, then we went to our colleagues. I know I picked on Karen a number of times for European input as an example, and of course we looked at from Australia and various perspectives as well. What is the concept behind FERPA? Well, it's student rights. How does that apply as well in the European Union or in Australia or anywhere else, as well as the U.S.? And that's the concept we would go after, if that helps clarify your ethics question.
I agree with you and Dieter. The performance standards that are on the website under the certification tab are really where your starting place is to see how you might want to prepare your application, number one, and your exam preparedness. So the performance standards are pretty explicit. There are several domains, and under each domain there are sub-competencies that good CHSE should exhibit. You can go to those performance standards and reflect on what areas you think you have strength in, what areas you think you need to read more about, and then go to the exam blueprint to see what kind of questions might be asked. And when the practice exam rolls out, that'll help you even further. But really, your study guide and your guidepost for this has to be the performance standards, which are the bedrock of the certification program. I think we have another question here on the other side of the aisle. Would someone else have a question over there? I'm just curious how many of you have already been certified? Just raise your hands. Okay. So I'm going to assume the rest of you are still trying to think about why you should do this particular exercise. And again, Andrew summarized it very nicely. This is an attempt to get some external validation for the knowledge, the skills, and the abilities that you have. Many of you labor in simulation centers in which there is no way for an outside validation, no way for outside validation of your individual efforts. And this may be important for your current job, future job opportunities. As this profession matures, you like to be on the forefront of saying, I know what I'm talking about, and here is my external validation of that. As you advocate for grants and funding and space and people, this can help demonstrate to the leadership at your institution that you know what you're talking about. This is the sort of standard way most professions have decided to move forward for the benefit of their members, and we're no exception. Yes, it's hard work. Yes, you have to fill out an application. Yes, you have to get references to vouch for your abilities. And yes, you have to take a secure exam, as much as we don't like to, as an assurance to the public that you have a body of knowledge which is generally agreed upon is necessary to be a certified healthcare simulation educator. Those are necessary criteria. They're not crazy criteria. They're not abnormal criteria. They're not unusual criteria, but that is how we've set up the certification program. And I would urge you, those of you who are thinking, why should I do this? Let's talk to some of us here who have been on the certification committee and heard from a number of people around the country. Talk to current CHSE. They're around. They have buttons, you'll see, and ask them the value of the certification. And therefore is a pathway to certification at the advanced level. And then for those of you who are operations specialists in your sim centers, now we have a pathway for you to demonstrate your knowledge, your skills, and your abilities. Again, all in an attempt to help you as members of these societies demonstrate that you know what you're talking about. That's really why we have the certification program. It's meant to bolster you, right, and advance the profession. We have a question here and then here and here. So, wow, that blew up. Let's try it. Can you use the mic there, please? You're right by the mic there.
Did you guys discuss, can you hear me? Did you discuss the costs of the tests?
The cost for submitting your application is $395 US for SSH, INAXL, and ASPE members, and $495 for all others.
Okay, for all the tests.
For everything.
Yeah, for one test, and if you have to retest, it's $175 and $275 for that same breakdown for the membership via membership.
So it pays to be a member of your professional society. You get a discount for that. There was two questions here, and then Dawn had a question. So a question over here, someone here in the middle. Yes, right here.
It wasn't really a question, but looking at the certification, the advanced certification level with the extensive portfolio process. Have you thought about going forward as more people become certified, having a mentoring program since it's such an extensive process?
Yeah, we have discussed a mentoring program. The challenge right now is how to do that in an effective manner. We also have some issues that we need to be very cognizant of related to there's a firewall that must exist that keeps anybody who has written the examination from the teaching to the test appearance. Now, even on the portfolio level, even though we just got to be very, very cautious about how we do that because we expect to have to go and accredit ourselves. We have to demonstrate our validity of our process, and so we are working out the mechanics of how that might work. I've got to make sure that, you know, if we're doing that, what kind of time commitment is that on the parts of our volunteers and so forth. So what we have right now is basically a process where you contact me, and then I walk you through as much as I can. And we're going to continue to work to improve that process. It's not nearly as robust as it could be, but we've got to be very careful about how we go about that to make sure we're getting you the right things and that there's quality behind it and so forth. But we'll do everything we can to help you in the meantime.
So the question about a mentoring process for CHSE-A applicants is we need a body of CHSE-A certificates. We have 16 now, and they don't know it yet, but they're going to be part of the mentoring thing. Because we feel the best people to mentor the CHSE applicants are CHSE certificates. So we'll do that. Dawn, you had a question? Okay. Nice and loud. Okay.
Well,
If you can, that'd be helpful.
poor Dawn has already been working too hard for us since she's losing her voice, I think. So.
Yeah, I've managed to lose my voice. The first thing is, when you're reapplying, do you pay the $395 again, or is that just a one-time fee?
Oh, for this recertification.
The recertification fees, it'll be roughly in that area. If you don't take the test, we're expecting a discount because there's none of the overhead related to examinations, and we're just that's one of the decisions that we're finalizing.
Okay, and then, because it's not an issue yet. But the second one is, when you're recertifying for the operation system or the A, is it the same kind of process where you do 45 hours of whatever? Or is it going to be different for those in the A and those in the OS category?
To be determined.
To be perfectly honest, we're still actually looking at that. I mean, there's a few differing opinions. You know, if you're an advanced level, does that mean you have to do more? Or is it sufficient to just demonstrate that at a higher level? And so that's a decision that we'll be discussing tonight at our committee meeting is one of the things, and that will be coming out shortly. The categories will still be the same because it still refers back to the standards.
Okay, thank you.
I do want to invite Mary Patterson, our vice chair, if she can come up. I know she's here over there, to come up to the platform too, just so she can participate in the Q&A. And let's continue with the question and answer, please, about the CHSE, CHSE-A, or CHSOS. Right up here up front.
I was approached by a colleague the day before yesterday, and his question was a valid one, and so I thought I would just repeat the question. I mean, I know the answer, at least I think I do, but he was curious as to the process in what determined what the KSAs were, what work went into developing it, whether it is for the CHSE or the OS. I think the process is identical. But irregardless, I think that the question speaks to how valid is the exam for the profession and what work went into developing it.
Okay. Did everyone hear the question? Jim? Okay. Essentially, the question boils down to what is the process that we go into in terms of developing our certifications and especially the examination. And that actually is a very important question for you all to understand. We didn't just throw this together and throw out a bunch of questions and say, hey, go take the test. It's not like that at all. The biggest thing that you have to go through to build something of meaning is a practice analysis. This also goes by the name of a job analysis, and so they're sort of used interchangeably. That is an extraordinarily lengthy process that involves a lot of very intelligent people, not only from the subject matter expertise people, but also from the psychometrician perspective. And so just to give you a quick snapshot of what we did for both CHSE and the CHSOS is you survey the landscape to start off with, and you gather everything from job descriptions to articles about what goes on in the world to books that might be written. It's any number of different pieces that give any kind of insight into what, for the CHSE, for instance, what is it that a healthcare simulation educator does? And for the CHSOS, what is it that an operations specialist does? You end up compiling all that list together, and then you pull a bunch of subject matter experts together, and you quarantine them for a few days, and you literally work your way through the list and have counter back and forth arguments, all those sorts of things like that to agree, is this something that an educator or an operations specialist does? And you go down the list, point by point by point. And that's all part of a practice analysis. Once you've done that, you put it all together, review it a couple times over to make sure everyone has agreement on the final product. Then guess what? It goes out to the entire world for validation and input. And that was for the OS, you saw a survey come out May-ish, was it, last year, something like that? And then we get all that feedback. We take it back to the SMEs again, and basically we have to address every single point of that feedback. We go and look at what it is for each of the items. We look at how the domains weight out based on the domains that we came up with, all the work we did. It's a standardized process that is essentially a norm for the credentialing industry, the certification industry. And so we follow that exact same process. You probably should get an idea about the fact that this probably costs us a lot of money as well, because when we ship people in from all over, as well as the time taken, as well as having our expert associates, the Schrader Measurement Technology, so also they do this as well as deliver our examination. It's an incredibly lengthy and extraordinarily rigid process to make sure that what comes out on the other end means something. Because we don't want to just be a bunch of people just writing questions over a beer or something like that. I mean, you've probably seen some exams like that. They're kind of a joke, aren't they? We are as far from that as you can possibly imagine, because we've gone through an extraordinarily rigid process to industry standards to come out where we are on the other side and have something of meaning. That when you go and say, I am a CHSE or I am a CHSOS, that means something, and that makes it worth it for you. So
I think I can also answer that the genesis of the performance elements, I think is what you're asking, the performance domains that we came up with was a long process. We started with some elements and domains of the nurse education program through the National League of Nursing. So Marianne Rislow, one of our certification committee members, brought to us the domains of the performance standards in that domain for nurse educators. And then we depended on Ian Curran, who you heard yesterday in our keynote address, was a member of our certification committee. He brought to us the Academy of Medical Educator, performance criteria and domains, which applied to MDs and PhDs in medical education. So we felt that we had enough baseline material from both nursing world, the PhD world, and the physician world that defined solid standards, performance standards for educators in those three areas. And then we move forward from there. So the genesis, the bedrock of the performance standards were the NLN standards and the standards from the Academy of Medical Educators, which is a UK medical education organization. We could not find a more mature set of standards in other areas, even though we had looked. And then the practice analysis, again, was a genesis of Marianne Rislow and the National League of Nursing. We repeated the methodology to survey over 1,100 folks from around the world about what exactly do you do in your job. And from there, we built additional performance standards. So it was clearly based on previous work done by established academies in education and an analysis of our own members. And I don't know if you want to.
And the other.
We can turn this mic on. Which is
Okay.
good.
The other piece of how valid, how reliable an exam is the psychometrics that are performed following the exam. And so we also did, again, by the industry standards, the psychometric analysis, and that actually continues to understand, are these questions good questions? So you're looking at things like Alpha Cronbach and the difficulty of the question and a lot more statistics than I can possibly describe. But again, that's actually a very intensive and also expensive process as well. So it's been developed, as Andrew said, to industry standards, both in the preparation of the exam, the practice analysis, the development of the questions, and then the ongoing psychometric evaluation of the way that we, the simulation community, responds to those questions, and is the test both valid and reliable.
Additional questions right up here, Mary Ann?
And just to add on to that a little bit, that's how the blueprint came about, from that practice analysis, from what everyone told us about what they do, because you don't want to have questions on the exam heavily weighted in things that people only spend, 1% of their time doing. So that the blueprint that indicates the percentage of questions on each of the standards came from that practice analysis. So, that survey gave us an idea of where you spend your time as a simulation health educator.
Thank you, Mary Ann.
And I'm just looking at the time. We've actually gone just a couple of minutes over. So if you have any more questions, I will defer them to bring them up to me either after the session or when you can find myself or Kristen Gadledge down in IMSH Central, and we'd be more than happy to answer your questions, but I don't want to make you late for your next session.
Before we leave, though, I'd like to have our current members of the and
Yes.
past members of the certification committee just stand up and be recognized by the folks who have stayed here in the audience. So please rise. Let's give them a hand for all their hard work. Right? Approach any of us, and we'll answer all your questions in private.
Thank you.
Thank you.